All right, there. The numbers are starting to go up.
Look at that.
Okay, we got attendees. Attendees are rolling in. Look at all those. Look at all those names. Excellent, excellent. So I'm going to introduce myself twice because. So I'm Dr. Ted Barnett. I am the high-tech doctor with low-tech solutions, and I am the president of Rochester Lifestyle Medicine Institute. And we're so glad that everybody is coming to our webinar, and I'm talking slowly as they come in so they don't miss a beat of what I have to say. Well, they've missed the first part already. Anyway, we're so excited to have our guest speaker tonight, Dr. Sal LaCagnina, who is otherwise known as Dr. Sal, and I'll be giving him a longer introduction in just a couple of minutes. And also Allison Ogawa, oh no, I'm sorry, it's Ogawa, there we go. Allison Ogawa, who's a third-year medical student at the University of Rochester Medical Center in Rochester, New York, where I am sitting right now. And so she is actually having enrolled in our current Jumpstart, which I'm going to tell you about right now. We have a 15-day whole food plant-based Jumpstart, and we run it every month. This is I think our 33rd. We've had just about 1,000 people enroll in our Jumpstart, and it's runs for 15 days from Saturday to Saturday. And we just had an article accepted in the American Journal of Lifestyle Medicine about our Jumpstart. So we're really thrilled about that because we get great results. And it looks like we're up to about 48 people. That's very good. And we started Rochester Lifestyle Medicine Institute we started Rochester Lifestyle Medicine back in 2015. And we've split into two organizations. We have the Rochester Lifestyle Medicine Group for anybody who wants to be seen one-on-one by a physician or a nurse practitioner. And the Rochester Lifestyle Medicine Institute is our nonprofit. For those of you wealthy donors out there who would like to support our great work, and or tell your friends who are wealthy donors, we can always use help. We are trying to reach out to as many disadvantaged people as we can. That's part of our mission. So before I talk any more about that, I'd like to have a word from our sponsors. So our engineer behind the scenes, Bob, let's advertisement, please.
If you suffer from the side effects of pharmaceutical commercials, including nausea, headache, vomiting, frequent trips to the pharmacy, or an overdrawn bank account, then Wafipben may be right for you. Side effects for Wafipben may include curing type 2 diabetes, reversing heart disease, weight loss, cholesterol reduction, easing of stress, lower blood pressure, reflux abatement, erectile function, clothing size reduction, regular bowel movements, smiles, vacations, good health, and children with puppies. Ask your doctor if Wafipben is right for you. Whole foods, plant-based nutrition. Maybe our ancestors did know the secret to good health.
That is great.
So thank you. So any way you can support our sponsors, please, for every head of broccoli you buy, we get 1 penny. So that's a joke, but anyway, I wish, right? So yeah, no, we don't sell anything. We just teach skills. So Dr. Sal LaCagnina is a lifestyle medicine board certified physician down in Fort Myers, Florida. He's been at the Lee Memorial Health System for about 26 years and just recently set out on his own and has a concierge practice taking care of lifestyle medicine patients or people who are interested in learning how to take better care of themselves. And he's the medical director of the Lifestyle Medicine Institute, which is the home of the Complete Health Improvement Program, or CHIP. And CHIP is this wonderful program. It's been around for a couple of decades, I think about 25 years now. It has more publications than any lifestyle medicine program. And we've been running CHIP programs since 2015. Only recently did we start, back in 2018, we started our own 15-day whole food plant-based Jumpstart, basically as a kind of an on-ramp to get people into to realize how powerful plant-based nutrition is and how powerful lifestyle medicine is. So that's about it. I would like, Dr. Sal has a lifestyle medicine webinar that you maybe you could just tell us briefly about that while Bob is setting up your, or you're setting up your own screen, right?
I'm going to set up the slide. Yeah.
Sure, that's you're going to decide. Let me just remind everybody, if you have questions, or please put it in the Q&A, not the chat. There is a chat going as well, but we'd like you to put the questions into the Q&A, which should be at the bottom of your screen, at least if you're on a computer. If you're on a phone or an iPad, it might be somewhere else. But yeah, so Dr. Sal has this great presentation he's going to be making. And afterwards, we're going to be running question and answers with help from our medical student, Allison Ogawa. So how's the sharing going there, Dr. Sal? Getting there?
I'm going to put it up now.
Yeah, go for it. Yeah, just let me talk. I could keep talking, sir.
Yeah, you're like me. We could keep talking for a while.
Perfect. Okay.
All right, let me just get. All righty, and I have to get rid of these pictures. It's going to hide the pictures. Okay, very good. Well, thank you, Ted. Thank you for that introduction. Thank you to the Lifestyle Medicine, Rochester Lifestyle Medicine Institute, to Bob Franke, who's behind the scenes, and to Allison for joining and helping at the end with questions and answers, and really to everybody that's on the line. Looks like we have 55 people already, which is great. So just to talk briefly, we have some learning objectives that are listed here, and you can see the screen, right, Ted? Can you hear me?
Screen looks good. Yep.
Okay, good.
Yeah, I can hear. I can hear you and see. Yep.
Okay, great. So our learning objectives state how nutrition fits into the overall framework of lifestyle medicine, and I would even expand on that and say state how nutrition fits into the overall framework of healthcare in and of itself, because as we know, and we're learning about this more and more, nutrition really has to be the early foundation for the number one prescription, if you will, that you write for your patients. I think it's really important, and even for ourselves, you know, as healthcare providers, we really should be role models for healthy living. So it really should be part of life in general. The second one is discuss how the evidence demonstrating that food actually influences health, and we'll talk about a number of studies. State the improvements in clinical outcomes for chronic diseases resulting from eating more plant-based foods. Obviously, we have sometimes an uphill battle to climb with some of our traditional physicians that are not necessarily lifestyle medicine trained. So we have to really show the clinical improvements to get more and more people in the choir, if you will. And then how to employ strategies, how to employ the strategies that really allow you to translate this evidence-based information about nutrition down to the level of patients, so that they know exactly what they need to do on a daily basis to really transform their lives.
Sal, I'm just going to interrupt for 1 second.
Yep.
I would say that more than half of our audience tonight is from the general public,
Yeah.
not just medical practitioners.
Okay.
You probably knew that.
That's good to know. I just have to get this thing out of my way. And I think. Why are we not? Okay. On the right way. I think I might have just skipped a slide. Yeah, I did. Okay. Okay, so those are the objectives. So really, these are the pillars of lifestyle medicine: activity, nutrition, sleep, risky substance use, social connection, and stress management. And we're going to primarily talk today about nutrition. So most people know this, and there's an estimated 50 to 80% of chronic diseases, and these are heart disease and diabetes and cancer, all the things that healthcare providers will take care of on a regular basis, which are either partly or significantly associated with nutrition. And if you really look at what nutrition does or what food does, if you eat traditional foods, oftentimes you end up with a chronic illness. If you eat more plant-based foods, you'll end up with a healthier life in general. So we know there is a very strong association between nutrition and chronic illness. And then when you really look at the percentage contribution of lifestyle factors to the common chronic diseases, and what's listed here on the right, cardiac disease, strokes, cancers, diabetes, obesity, these are all common diseases that healthcare providers take care of every day and that unfortunately people suffer from. But as the slide shows, 82% of the cases of heart disease are strongly related to lifestyle factors and specifically nutrition. 70% of the cases of stroke, 71% of the cases of cancer, 91% for diabetes, and 98% for obesity. So what that really tells us is that when you look at a disease or a disorder that a person has, look at their lifestyle, because it has a significant impact on the development and the progression of those illnesses. So what is the standard American diet? The standard American diet basically consists of the things that you can see on this on the picture here. Too much salt, too much saturated fat, refined grains, higher in calories because of all the fat and sugar, and too little in all the other things that are listed here. Too little fruits, too little vegetables, too little whole grains, nuts, seeds, legumes. So these are the things that we really try to focus on when we talk about eating a healthier diet. The standard American diet has a significant impact. In America, we spend more money on healthcare than any other country in the world. And we are unfortunately one of the unhealthiest industrialized nations worldwide. We have significant, we're just getting through, hopefully, we're just getting through this pandemic. But if you really look at these illnesses, diabetes, dementia, heart disease, high blood pressure, obesity, arthritis, these are almost epidemics that we as healthcare providers take care of on a regular basis simultaneously. So we've been dealing with one pandemic in the past year, but primary care physicians and a lot of the subspecialists will be caring for patients that have multiple chronic diseases at one time. So there's a lot that we can do when we help them really transition to a healthier diet. And what do we actually mean by food? Food is made up of macronutrients. These are proteins, fats, carbohydrates, micronutrients, which are all the vitamins, minerals, and antioxidants that are in the foods that we eat. And I love this picture because I'll always ask my patients, what does this picture actually signify? What does it show you? And the colors are so important because the colors are actually the phytonutrients that are in the vitamins that are actually in the fruits and vegetables that we want people to eat. So the importance of phytonutrients from plant foods, these are, I'm even hesitant to say non-essential micronutrients because I actually think technically they are essential micronutrients that really will allow us to be healthier. They have bioactive functions because vitamins and minerals and antioxidants act as enzymes in chemical reactions within the cell. But basically, these are the things that keep us healthy. They're anti-inflammatory, they're antioxidant, they're anti-aging. I'm sure that there's no one on the line that is not interested in slowing down the aging process, anti-cancer. And when you really look at where should we, or ask the question, where should we get our vitamins from, our micronutrients from? Not necessarily from store-bought supplements, because that might be only one thing that you're taking, one element. But when you eat a wide variety of whole foods, you're getting all of the micronutrients that you really need to stay healthy. Whole foods are best. They're better because there's no added sugar. There's a different type of starch. There's no flavorings in there. There's no manufactured ingredients. So all the things that that will make you less healthy, these are not found in whole foods. So we really want to be sure that, again, we're getting our macronutrients and micronutrients from the foods that we eat, and then obviously drinking enough water to keep ourselves hydrated. The Dietary Inflammatory Index, this was developed in 2009 to provide a quantitative means for assessing the role of diet in relation to health. And what you're really looking at here on the left side in the picture are foods that are anti-inflammatory. So on a regular basis, we really should be adding the majority of these foods and spices and herbs to our food to really increase the nutritional value and to decrease the inflammatory index. I think when Dr. Barnett and myself and many others started medical school, there were probably maybe a dozen, maybe 2 dozen autoimmune illnesses. Now, if you take a list, there's probably over 110 from my last count. So a lot of the toxins that we get in our foods cause inflammation. And conversely, you want your patients and you want people in general to obviously be on an anti-inflammatory diet to decrease the incidence of autoimmune diseases and other illnesses. Oops, I think I might have skipped a slide here. So inflammation and plant-based diet. Randomization to plant-based dietary approaches leads to larger short-term improvements in the dietary inflammatory index scores. This is because the micronutrients are healthier, they have less inflammatory chemicals within them, and obviously you want to be sure that you're helping people eat a healthy, anti-inflammatory diet. And the references down at the bottom here, and certainly we'd be glad to share the slides with anybody that would like to look at the slides later on. So inflammation, you know, this is a great slide because chronic inflammation is really the common denominator for so many of the illnesses people suffer from today, whether it be cardiovascular disease, diabetes, and the metabolic syndromes, just chronic inflammatory diseases in and of themselves, different types of bone and musculoskeletal diseases, and then even cancer. We know that fatty liver is a situation where there's a lot of inflammation in the body, and then many of the neurodegenerative diseases. So when we look at illness in and of itself, we have to look at what is the common denominator, because so many of these illnesses occur simultaneously. I mean, there's probably not a day that goes by that I don't see an individual with some form of cardiovascular disease and some form of metabolic syndrome. And if they have that, they have a fatty liver. So again, we have to look for ways to treat the chronic inflammation to take care of many of those diseases simultaneously. There's a strong relationship, as we know, between food and cardiovascular disease, and that's because of the high levels of saturated fat and cholesterol. When individuals are eating more fruits and vegetables, the relationship is actually the opposite. And the fish and the importance of long-chain omega-3 fatty acids, oftentimes the literature really shows that eating foods that are higher in omega-3s is actually better than taking supplements. And we'll talk a little bit about the Mediterranean diet and the DASH diet. The picture on the bottom really is important because what that actually is basically a pictorial of the inside of a blood vessel. And the problem that comes in is what's called endothelial inflammation or endothelial dysfunction. When the inside lining of the arteries becomes inflamed, that's when plaque develops. And you can see in the picture, there's all that stuff that's stuck to the walls, if you will. And when the blood cells are actually trying to get through that artery, they actually have a barrier. There's actually a barrier, and a lot of the blood cells get stuck to the sides of the walls, and that's when plaque forms, and that's when you have a significant problem with blood flow to whatever organ that artery is feeding. So there is a strong relationship between food and cardiovascular disease, which right now is really the #1 killer in this country and domestic and other industrialized countries. Meat intake, and you know, I think this is where we have to be very careful about how we approach the conversation. The discussion about food is very emotional for people. If you approach it in the wrong way, people will oftentimes become very defensive because it almost sounds like you're saying that there's something wrong with them by living a particular lifestyle. But what we really should be doing is looking at the science. So in 2019, there was a meta-analysis of 123 studies. What it actually showed was that red meat increased the risk of coronary heart disease by 15%, strokes increased by 12%, and heart failure increased by 8% in individuals that were eating more meat. Processed meats, as is shown in the bottom slide, so lunch meats, sausages, hot dogs, bacon, things like that, processed meats increased the risk of heart disease by 27%, strokes by 17%, and heart failure by 12%. In the 2014 meta-analysis, this was took into account 13 cohort studies, which all combined accounted for 1.6 million individuals. Subjects that were in the highest categories for eating meat, for eating processed meat actually, had an 18% higher risk of mortality from heart disease. Red meat consumption was associated with a 16% higher risk of cardiovascular disease. And when there was an increase in processed meat intake of only 50 grams per day, that's like one hot dog or 6 slices of bacon, this was significantly associated with a higher incidence of all-cause mortality and cardiovascular mortality. If you double that and eat 100 grams per day of a processed red meat, which is just 0.2 pounds, this was significantly found to be positively associated with more cardiovascular mortality. So, you know, the bottom line for all of us in general, and certainly for healthcare providers counseling patients on what they should be doing, I think you have to present the science to people and then help them make a decision that's best for their health. So plant-based diets in cardiovascular disease. There's considerable evidence that supports the cardiovascular benefits of healthy plant-based diets, and these diets and their constituent foods are getting increasing recognition in dietary recommendations. What we're basically seeing is, if you look at the recommendations from a lot of the national organizations, American Heart Association, American Diabetes Association, you know, we're seeing more of these organizations basically saying that parts of the treatment and the reversal and the prevention of disease really has to significantly support the use of plant-based foods. And this is really just, these studies really just show that when you have individuals eating more plant-based foods, there's a lower risk of coronary heart disease mortality and a lower risk of stroke. So the literature is really clear. In the Intermap study, this was the conclusion. Vegetable protein intake was inversely related to blood pressure. So we know that blood pressure is a significant problem today. So many people either have it or are treating it if you're a healthcare provider. This finding is consistent with the recommendation that a diet high in vegetable products be part of a healthy lifestyle program for the prevention and even the treatment of high blood pressure, of hypertension. I can tell you in my practice, and really in the last 26, 27 years that I've been practicing medicine, the individuals that are eating more whole foods lower their blood pressure, their weight comes down, their cholesterol comes down, their diabetes improves. So there really are significant benefits in really helping people transition to more of a plant-based diet. So that's the Intermap study. This is the Regard study. This is Reasons for Geographic and Racial Differences in Stroke study. So the individuals in this study that were adhering to a Southern diet, now I'm sure that you could all understand what a Southern diet is. Higher in fats, higher in greasy foods, things that people really love to eat in the South and other places. This type of a diet increased the risk of hospitalization due to heart failure by 72%. The risk of heart failure hospitalization was 41% lower in the people that adhered to a plant-based diet. So adherence to a plant-based diet was inversely associated with the incidence of heart failure, and the Southern dietary pattern was positively associated with an increased risk of heart failure. And again, the reference is at the bottom. So when you're having these conversations, which again, oftentimes is somewhat of an emotional conversation, just really stick to the science and help people understand what the science shows, so that you can really help them make the right decisions in their life. Just want to make sure this thing is clicking kind of fast. I don't want to miss any slides. This is a study that looked at the Mediterranean diet and cardiovascular disease. And we're always going to find some studies that might not be strongly associated, but we have to look at all the evidence, certainly. And what this study showed was that a Cochrane review concluded, despite the relatively large number of studies included in this review, there is still some uncertainty regarding the effects of a Mediterranean diet on clinical endpoints and cardiovascular risk factors for both primary and secondary prevention. Now remember, and you can see anything to the left of this line in the middle there, shows benefits, but some of the little arrows there are really pointing more towards the right side, which would indicate more of a higher risk. What you have to remember about the Mediterranean diet is it includes meat and it includes oil. So that actually might be the reason for some, for these conclusions being not as strong as some of the other studies that we've already looked at. And I think that in and of itself is actually supporting the recommendations that we're trying to make. So what does a healthy plant-based diet actually do? And what does it actually bring to the table, if you will? A lower energy density, a higher index, a high dietary fiber, appropriate fat consumption. You want to make sure that you're getting more healthy fats from avocados and walnuts and flaxseed that are higher in omega-3s, lower in saturated fats, higher levels of antioxidants. All of the colors in the fruits and vegetables that we should be eating signify the vitamins, the minerals, the antioxidants that are in these foods that help to keep the foods healthy, and they actually keep us healthy. Higher levels of certain micronutrients such as B vitamins, magnesium, and potassium, and lower levels of other dietary factors. And we know that heme iron is a problem when we talk about like all of the problems that come about from eating more animal protein. Nitrites and nitrates are more problematic as far as health in general. So all of that, all of those benefits there, what they actually translate to is better weight maintenance, enhanced glycemic control, improved lipid profiles, as the previous slides mentioned, reduced blood pressure. Anything that decreases inflammation will improve vascular health and obviously decrease systemic inflammation. And then we also have to remember, when you're eating, you're not only feeding your own body, but you're feeding the trillions of bacteria that reside in your microbiome. And when you're eating more plant-based foods, you're getting prebiotics, which feed the bacteria, and you're getting probiotics, which feed you and feed your digestive tract in a way that it really keeps you healthier. So lots of benefits there. Now, we know that diabetes is a significant health problem. I'm an adult physician. I'm an internist by profession. It's really amazingly unfortunate to see now that many adolescents are being diagnosed with type 2 diabetes. In past years, we always thought that type 2 diabetes was a disease of adults, but now we're seeing it more in younger children and adolescents because really of the epidemic of obesity. And the relationship between food and diabetes is significant. In population studies, higher intakes of fruits, vegetables, and whole grains reduce the incidence of type 2 diabetes. And the opposite happened when individuals were eating more fat and more sugary foods. The intervention studies had mixed data on the impact of carbohydrates. Now, this is an area that we certainly really should think about for a second. You can have processed carbohydrates or you can have whole food carbohydrates, and they have dramatically different effects on health in general. If you're eating more processed carbohydrates, your risk of diabetes and many of the illnesses that we talked about so far would be higher. If you're eating more whole food carbohydrates, fruits and vegetables, your risk and incidence of disease is lower. Vegan diets or plant-based diets reduce the risk and incidence of diabetes, and being overweight or obese was significantly a risk factor for type 2 diabetes, as well as one of the biggest risk factors for increasing the incidence of coronavirus and increasing the overall complications. So lots of relationships there that we have to remember when we counsel ourselves and our patients. Again, I want to just make sure I keep slipping. I apologize. I keep slipping over one slide. Plant-based diets and diabetes risk. This was another meta-analysis that found that adherence to a high-quality plant-based diet was associated with a significant reduction in diabetes. And really to emphasize, you can be eating a vegan diet, if you will, and be eating a lot of Twinkies and Oreos. You have to be on a high-quality vegetables and fruits and nuts and legumes and grains That's a high quality plant-based diet to really see the benefits. Similarly, a meta-analysis of 2 cohort and 12 cross-sectional studies found that a vegetarian diet was associated with a 27% reduction in the incidence of type 2 diabetes. Many people know the Adventist study. The Adventist study has been going on for many years, and this was actually the second study. And this showed that vegans and individuals that were having some meat and eggs as part of their vegetarian diet still had a significantly lower rate of diabetes as compared to semi-vegetarians or pesco-vegetarians that were eating vegetables as well as fish. So again, we're looking at declines in the incidence of diabetes depending on the types of foods that you eat. So foods and other chronic illnesses, dementia and Alzheimer's disease, fatty liver disease, non-alcoholic fatty liver disease, cancer for prevention and management, and COVID. When we really think about how do we keep individuals healthy, and it's interesting, I write for the local newspaper down here, and I just wrote about the importance of particular organs in our body. And certainly the brain is one of those organs that is primarily important. When you look at the fact that obviously your heart is important, and your kidneys and your liver and all these other organs are important, it's really interesting to think about the fact that if those organs become diseased, you can actually replace them. You can transplant a heart, a kidney, a liver, even lungs. You can transplant skin, cornea. You can't transplant your brain. So and given the fact that neurodegenerative diseases have been on the rise, we really have to think about how do we keep our brain healthy in addition to everything that's below the neck. And given the fact that these diseases have been on the rise for several decades now, we really have to be sure that we're feeding the body and we're feeding the brain healthy food so that it stays healthy for a lifetime. So Alzheimer's disease. For the people that are on the line that are healthcare providers, we all know that the few medications that are on the market currently and the probably hundreds of medications that have been tested for treatment of Alzheimer's, just really don't work. This is a disease that's considered incurable. More than 100 drugs have been tested and failed. The ones that are currently on the market really do not do much to either slow the progression, they certainly don't reverse it, and they certainly don't cure it. Most recent studies show that anti-amyloid antibody drugs being considered by the FDA have marginal impacts on cognitive outcomes in spite of significant reductions in amyloid plaque. And actually, if you look at the physiology of the neurons that are in your brain, the brain actually has amyloid and it has tau protein in normal brain cells. What actually happens with the progression of these neurodegenerative diseases is that the proteins become distorted, and that's when they start clumping together and they make it harder for the neurons to actually transmit their signals. Only a handful of medications are FDA approved for symptom management, but again, as the first bullet point says, this is an incurable disease. So if you have a risk factor, or if you have multiple risk factors, if you have a genetic predisposition to Alzheimer's and there are no good treatment options as far as medications, what do? You really have to focus. The answer is focusing on lifestyle and food, certainly. Multiple studies have actually shown that lifestyle and dietary changes will help prevent cognitive decline. This was an interesting study, the FINGER study, the Finnish Geriatric Intervention Study to Prevent Cognitive Impairment and Disability. This was a multi-domain lifestyle intervention program using at-risk older adults to prevent cognitive decline. In the MIND study, which is actually the combination of the Mediterranean and the DASH diet, and this was for the intervention of neurodegenerative delay, what they actually found was that individuals that were adhering to the MIND diet had a 30 to 35% lower risk of cognitive impairment, and the MIND dietary adherence predicted an incidence of Alzheimer's that was significantly better than either the Mediterranean diet or the DASH diet alone. So again, combining nutrition programs that really emphasize a whole food plant-based approach has been shown by evidence-based research studies and clinically in anecdotal reports over and over again that this absolutely is the right way to create a healthy nutrition program for people. You can use different types of spices, and for those people that are listening, if you're not using curcumin in your meals right now, you should be doing that. The spice turmeric inhibits the accumulation of the beta amyloid in the brain. It's a powerful antioxidant. It possesses anti-inflammatory properties. So again, Alzheimer's also appears to have inflammation as part of the foundation. And this is really a good recommendation that when you're cooking, you should be adding things other than salt and pepper to your food, because there are so many spices and herbs that really should be used because of their chemical benefits to lower the risk of disease. The low molecular weight and polar structure of the turmeric actually allows it to penetrate across the blood-brain barrier and make it more effective. It says here that human studies are more limited and inconclusive to date. Extensive use is possibly why the rate of Alzheimer's is lower in India, about 4.4 times less in adults that are age 70 to 79. So when you really start comparing countries that eat significantly different foods, you can really see that there is a definite difference in the incidence of a lot of these diseases. Plant-based diets and fatty liver disease. I think probably when I started medical school and early in residency, we really thought that fatty liver disease really wasn't a big problem. But as we know now, decades later, that this is a significant risk factor for cirrhosis and liver cancer. So we really have to treat it effectively. And in this particular study in 2020, this was a randomized control study that lasted 16 weeks in 244 overweight participants who were randomly assigned to either a low-fat, a vegan diet, or a control. And the subjects that were in the vegan diet arm lost significantly more weight. They improved their insulin sensitivity, and they had reductions in liver fat. So if you can accomplish those things, many people come into the clinic really looking to lose weight, but you often find that these individuals are insulin resistant, they have fatty livers. So helping them create a nutrition program that solves their weight problem, that gets rid of their fatty liver, that improves their insulin sensitivity, really does a lot for these individuals to make them healthier. So meat and cancer. If individuals that are on the line, or your patients or your family or friends don't already know about the World Health Organization report that was in 2015, they absolutely should know about that now, because what the WHO report actually showed was that consumption of processed meat is carcinogenic to humans, and it's in quotation marks for a reason, because this was actually the language that was used in the report. Consumption of processed meats, consumption of red meats. When an organization says that there is a higher risk of cancer, we really have to pay attention to that as individuals, as healthcare providers, as family members, to really help individuals lower their risk of cancer. The recommendations were primarily based on a literature review of more than 800 studies by a group of 22 world cancer experts. So this was a significant study that had a tremendously significant impact on what we should be recommending to people as far as healthy nutrition. There's strong evidence for the risk of colon cancer, but the risk was also found for stomach cancer, pancreatic cancer, and prostate cancer. In the Adventist Study, this was a plant-rich diet, and they looked at the association between plant-rich diets and cancer. In individuals that were pesco-vegetarians, they're eating some fish and vegetables, there was a 43% reduction in the risk of colorectal cancer compared to non-vegetarians. Both vegans, strictly plant-based individuals, and vegetarians that were having some meat and eggs had a 17% reduction in the risk of colorectal cancer. People that were, traditionally called vegans, eating more plant-based foods, showed consistently a lower breast cancer rate, but there was a non-significant point estimates as a result of this study. But again, it really points to the fact that when we actually look at cancers, whether it be colorectal cancer or breast cancer or even prostate cancer, the individuals that were eating more plant-based foods and more whole foods that are shown in the picture here had lower rates of cancer in general. So just another great recommendation, another great evidence-based program. The American Cancer Society recommendations, when these organizations really put out their statements, this is really what you want to hear. The American Cancer Society recommends a healthy eating pattern that includes a variety of vegetables, and they're saying specifically dark green, red, orange, fiber-rich legumes, beans, peas, etc. Fruits, especially whole fruits in a variety of colors. Again, the colors signify the vitamins, minerals, and antioxidants that come with those whole foods, and then whole grains. And they also say, conversely, limiting your intake of red and processed meats, sugary sweet beverages, highly processed foods, refined grains, and alcohol. So this is great to see that these national organizations have really gotten on board to give us recommendations that really make sense for people. The mechanisms of diet and cancer prevention. Low-fat diets may reduce reactive oxygen species and lower the risk of cancer-promoting hormones, as shown in the first bullet point. What that basically means is that reactive oxygen species are basically the components inside the cells that create inflammation. So low-fat diets decrease inflammation. Plant-based diets also decrease insulin growth factor 1. This is another hormone in the body that when it's high, there is a higher risk of cancer. And we know that plant-based diets will decrease IGF-1. So conversely, the rates of cancers decrease. And then low glycemic index diets. The glycemic index basically shows you or tells you how quickly your sugar level, your glucose level in the body will go up depending on the types of foods that you're eating. And low glycemic index diets have been associated with lower rates of prostate, colorectal cancer, and lung cancer. And if you're not eating broccoli and cauliflower and and the brassica vegetables, we know that these are anti-cancer and they have significantly better phytonutrient levels, and they really should be included in the daily intake of your fruits and vegetables. Oops, I think we skipped one. Oh, this is a great one. Okay, so this other slide here, this is a little more difficult to really look through quickly, but I would recommend that you do that if you really want to understand what's happening inside the cells. So when we look at the coronavirus and inflammation and what's actually happening to individuals in the short and in the long term, we know that inflammation is a significant part of the pathophysiology for the COVID-19 virus. Risk factors for severe COVID-19 infection may include other chronic common diseases. So we know that individuals that already have diabetes or heart disease, hypertension, or cancers have a worse prognosis. And it's really something that we need to focus on to help people stay well so that if they do get the infection, they hopefully can get better quickly. Chronic inflammation isn't, yep.
So I just want to stop you for 1 second. It looks like you're showing a part of a lung there. Is that right?
No.
Your diagram. Is that
the diagram is actually, well, yeah, actually this is supposed to be the inside of the cells themselves. Right, it's actually, yes, you're correct. Okay. So this is really supposed to be showing what happens as far as the injury and the inflammation and all the the chemical factors and such. Yes, thank you for pointing that out. That's correct. Sure. So the chronic inflammation is really an underlying risk factor. And again, I use the word inflammation over and over again to really point out the fact that this is a chronic common denominator for many of the illnesses that we're dealing with. And now in the last year, we have to deal with the COVID infection, and we can see how it creates so many chemical changes inside the body that if we can find a way to decrease inflammation, we can help improve the prognosis, both in the short and the long term. To date, we don't have data on diet and COVID risk per se, but I think with all of the information that we know currently, if this is an inflammatory disease, and we already know from so many of the research reports that I talked about previously, that we really have to make the same recommendation. So for individuals that are at higher risk, help them deal with weight problems, help them deal with getting their diabetes and heart disease under control, hopefully before they ever get the virus in the first place. So I think that might be the last. Okay, so now, so how do we actually take all of this information and really put it into practice? Because, you know, as physicians and healthcare providers, we're scientists. We have to take the information that comes from all of these research studies and translate it down to the patient level so that people can understand it clearly and really put it to use on a daily basis. We have to dispel the myths, because we know there are a tremendous number of myths. We have to understand clearly what the science shows. And then we have to really work with individuals to get rid of the barriers, to go around them, under them, over them, to really implement what we call, you know, healthy nutrition action plans. So for providers, barriers to lifestyle and nutrition counseling, there's sometimes a perceived ineffectiveness of interventions. And this is one of the reasons, you know, I know Dr. Barnett is board certified in lifestyle medicine, as am I, and so many other people that we know and we've met over the years through the American College of Lifestyle Medicine. We really have to start teaching and really pointing out the fact that these interventions are extremely effective. They're not ineffective, and it is not a perception, it is a reality based on science. There is a perception that a lot of physicians and healthcare providers have that says patients won't change, it's too hard to change. Well, it's not our prerogative to say that an individual won't change his or her behavior. Present the science to them, try to give them healthy living action plans, and let individuals make the decision for themselves, but work with them so that they make the right decision, so that they don't continue to come back as sick individuals. There are diet wars, and I love the way Dr. Ornish describes what an optimal diet is. He says very clearly, there's not one healthy diet for diabetes, and then a different diet for cardiovascular disease, and then a different one for Alzheimer's disease. It's all the same nutrition approach. It's a whole food, plant-based diet that keeps people healthy and lowers their risk and incidence of chronic disease. Institutional barriers, maybe a lack of time, a limited referral resources. What the physicians and the healthcare providers can do is to try and get rid of all those barriers so individuals can really be on the road to healthier living and can really move from the standard American diet and the standard American lifestyle to more of a healthy plant-based approach and a plant-based lifestyle, if you will. Barriers to healthy eating, the cost of healthy food, that is absolutely a myth. If you do not believe me, go out and do this yourself. You can go to a dollar store where you can buy bags of beans and bags of rice. You know, rice and beans, not that you have to eat them every day, are really inexpensive, high protein, high quality, nutritious foods. You can buy your foods at your fruits and vegetables at a farmer's market. You can buy them in bulk. So they're, you know, the whole issue of healthy food being a myth is really a myth. Lack of food availability, that certainly is something that we have to deal with. There are many communities that are food deserts and food swamps where basically there are very few groceries, big grocery stores that have lots of healthy food. So we have to work in our communities to help those individuals have access to healthier foods. Time, we all have the same amount of minutes per day that we can use. There's 1,440 minutes in a day. Each of us has to decide how we will use our time to do something healthy. Before we got on the line, Ted was telling me that he had a little bit of time before the program. So he went out and ran a mile and a half. If you use your time wisely, if you're mindful about how you use your time, if you're mindful about how you prepare your foods and eating healthier foods, you take the time constraint out of the way. It's not a barrier anymore. And then either unwilling or unable to cook. If you don't like to cook, find somebody that can cook for you. In my practice, we actually have a teaching kitchen, and the gentleman that works for us does prepared food, so people just come in and buy it. So again, getting rid of the barriers so that you can live a healthier life and the quality improves. Beyond the diet sheet, implementing a successful nutrition plan with patients. You really have to become proactive at addressing health problems with individuals. You have to do this in a sensitive way so that the individual becomes on board with the actions and with what you're trying to help them with, so that they don't become defensive. But you really have to proactively address the problem. And even if the individual is not in your clinic for asking for help with their weight, if they are overweight, if they are, even if they're there for something else, you really should proactively address it, because as it said in the previous slides, weight is a risk factor for COVID-19 and a risk factor for all of the other chronic illnesses. You want to help individuals to shift their mindset to disease prevention. We in America really have a sick care system. We don't have a healthcare system. We really should be focusing, and this is one of the reasons that Dr. Barnett and I just love, and so many other people love ACLM and the Plantrician Conference, all of these programs that really allow you to understand that disease prevention is what we really should be doing. In addition to being a healthcare provider, each of us individually should be doing that. So we really have to shift our mindset and empower individuals to understand that when you take control of your own health, you really can change whatever you think your destiny would be, even if you've inherited some bad genes, if you will. Encourage individuals to make small changes and to set realistic goals. When you're making changes, at the beginning of every year, individuals will make their New Year resolutions, if you will. And those are oftentimes, I've heard the term BHAGs, big, hairy, audacious goals used. When you make a goal that is too big, it's probably unachievable. So you want to make small changes in your behavior that become habitual so that you can see the positive benefits. And when you do that, you continue to make then more and more changes, and you're moving down that journey to being healthier. So make small changes, realistic goals. Know where to send in individual patients that need help. So as a healthcare provider, make sure that you have resources and options available for people, because as a physician or the primary healthcare provider, you don't always have enough time to do all of the counseling that you need to do. So make sure that you have a dietitian on board that you can refer your patients to, a health coach, a trainer, somebody that can really help them with all of the other pillars of lifestyle medicine. And starting the conversation with individuals, you really want to figure out and talk about who does the grocery shopping at home, who does the cooking, what are some of your favorite food recipes and traditions. And there used to be a program, I'm not sure if it's still on television, it was called Rehab Your Recipes. And what these two vegan chefs did was they actually went into people's homes, they took their favorite recipes, which are oftentimes very unhealthy, and they rehabbed them based on whole foods and foods that were healthier into something that tasted just as good, but was significantly more healthy. And then when you're thirsty, what kinds of drinks do you reach for? Certainly water is one of the best. And does eating healthier seem to be hard or unrealistic? Help people move from where they are now, understand their readiness to change, do motivational interviewing. And this is one of the reasons that it's helpful to have a health coach on board, and really help individuals move from where they are today to where you would like them to be over time. The politics of nutrition. If you have not seen the documentary called What the Health, I would recommend that. It really is interesting to go behind the curtain, if you will, like in The Wizard of Oz, and see what's actually happening behind the curtain, because oftentimes politics will influence nutritional guidelines. And what we have to do as healthcare providers is to try and clear all that away, look at the science, and try to explain to individuals what the science actually shows. Dr. Elkind, president of the American Heart Association, said his group was disappointed that the USDA and Health and Human Services did not accept all of the Dietary Guidelines Advisory Committee's scientific-based recommendations in their final guidelines for 2020. This included recommendations to lower added sugar consumption to less than 6% of calories. And really, this has to do with politics. When an organization is supported financially by the wrong individuals or companies or groups, they make recommendations to the public that might not necessarily be in the best interest of the individuals. So we really have to keep that in mind. I'm actually talking tomorrow to another group about lifestyle medicine and lifestyle is medicine. This is actually the next in a series that I'm doing. So, you know, this talk today was really specifically about nutrition in general. But if you really should be doing this as an individual healthcare participant, somebody that's receiving healthcare, or if you're delivering healthcare, you really want to focus on all of the pillars of lifestyle medicine and create a program for yourself and for your family and friends and your patients that really allows people to stay healthier through the activity and the nutrition and sleep and social connection and stress management and all the pillars of lifestyle medicine. So that was the last slide. I'll leave it at this one here. And then we're going to go and open it up for some questions. So I guess I can get out of here.
Thank you. Sure. Thank you very much, Dr. Sal. That was a great
My
presentation. Yeah.
Sure.
And Allison, do we have some interesting questions lined up here? What do you think?
Do you want to put any, can you put everybody
Yes,
on the screen?
Can we put the questions on the screen?
No, can you actually
We'll
put
just-
everybody's pictures up?
No, this is a,
No?
sorry.
Ah.
This is a, it's safer this way. Trust me. You never know who's good.
Okay.
This is a, yeah. So, yeah, thank you for that. I've got a few comments myself, but I'm gonna, well, actually, before I let Allison jump in there, a couple of things I just want to mention, because you said that, talked about the CME yesterday. We actually now have a CME course, which means continuing medical education for physicians and other healthcare providers. It's 24 credits, and 10 of those credits actually come from participating in the Jumpstart Live. So it's unique. There's no other program like it where you can, as a physician, participate with patients and see the kinds of questions they ask and how we answer them and the kind of progress and challenges they have. So that was a little pitch for that. But now, Allison, I'll turn it over to you.
Awesome. Well, thank you so much, Dr. Sal, for that presentation. It looks like we have a lot of great questions here. And there's one in particular that I'm going to kind of frame in a larger context. I think a lot of people see things come across Facebook or their news feeds about try this new diet, try this new diet. And, you know, determining what is a fad diet versus what is a scientifically backed up diet can be challenging. So we have a question in the chat that that asks about what are juice cleanses, and are those healthier? Are those less healthy? How do those contribute into this whole picture?
Right. I think when people are juicing, and oftentimes, and I will ask my patients this, are you actually using a fruit juice or are you using a vegetable, juice? Because I think we have to be clear about the terminology. But when you're fasting and when you're doing juicing, that usually is a fruit juice. And if you think about what actually happens physiologically at that point, you're basically infusing a tremendous load of sugar into your system. So your level of glucose goes way up, your level of insulin goes way up, and what traditionally happens an hour or two later is that your glucose level comes down, the insulin level lags behind that, and insulin, and oftentimes people get hypoglycemic. So I don't necessarily think that it's the healthier way of cleansing your body, if you will. I think you just have to be careful that you're not putting yourself in a situation of becoming hypoglycemic, and then you're reacting at that point to all of the physical symptoms from the hypoglycemia, and you're just reaching for something to eat at that point because you feel physically lousy. So I like vegetable smoothies, which I think is great if you're going to fast for a particular period, but you want to be sure that you're getting some nutrition and hydration. I think a green juice is much better because you're actually using vegetables as opposed to just fruit juice.
Awesome. And to follow up on that, there was a question asking, I'll just read it. Can you clarify eating spinach, blueberries, apples, oats, water, chia seeds, dates, which have been blenderized, is less helpful than chewing and eating these foods without matching them first, is I think part of the question. And then talking about, does chewing allow slower absorption of nutrients? So is there kind of a benefit to blending versus not?
Yeah, it's interesting, if you ever really want to get more answers from an individual that we both know is extremely knowledgeable in the science of nutrition, I'll oftentimes go to Dr. Greger. Mike is just a wealth of knowledge, and his website, nutritionfacts.org, is just a great resource for us. It really does appear that blending may do something, I don't really want to use the word harmful, but I really can't think of another better word right now, to the fiber. So the short answer is it's probably better to actually eat the food. Now, if you don't have enough time to be eating a bowl of vegetables and some fruits, and you want to blend it, at least in that scenario, you're still getting the phytonutrients in there that we know are beneficial. So I would say primarily you want to eat the food. Digestion starts in the mouth, as we know, and it really prepares the rest of your GI tract to absorb the food that's coming down the pipe, if you will. But if you can't do that because you have to run off to work, then taking a green juice with you is certainly the next best option.
Awesome. Thank you. I can toss it over to Dr. Barnett for a few.
Sure. So someone was asking if she says she's a vegan, and she's wondering how she can get her long chain omega-3s without fish.
Well, flaxseed, walnuts, there's really, it's more limited if you're not eating any fish. What I generally tell people is, to get more healthy fats in your diet, I include avocado pretty much every day, at least a half an avocado, and then really getting, putting flax in whatever you can put it in. If you're going to have some grains and cereals and things like that, and making sure that you eat some walnuts, and it makes it more difficult if you're not eating fish. But the problem with fish, and chime in here, either Ted or Allison, the problem with fish today is the fact that so many of the larger fishes are more contaminated with so many different chemicals that are in the oceans. So if you're getting your omegas that way, you really just have to be careful not to have too many servings per week.
Right. Yeah. It's fish is kind of one of those things where they tell you should have to have it twice a week, but if you're pregnant, don't have any because it'll be bad for your kid, and you shouldn't have more than a certain amount. So that's kind of a red flag.
Right.
What I like to remind people is that alpha linolenic acid, which is the main long chain fatty alpha omega-3, is the most common fat on the planet because it's in leaves, and we just need to be eating more leaves. The issue about omega-3s and omega-6s is that it's a balance, and if you're having a lot of omega-6s, you probably need more omega-3s. But a whole food plant-based diet is very low in omega-6s anyway, so you probably just need the kind of amount you can naturally absorb from ground flaxseed and lots of green leafies. So I don't think that's a major issue.
Yeah, and I think you hit the nail on the head with the word ground flaxseed. It's actually healthier if you grind the flaxseed just before you're going to consume it. because when it's pre-ground, there's more problems with mold, and it's less nutritious, if you will.
Right. Yeah. Omega-3 fatty acids are very unstable, which is why they have been taken out of processed food, because they are unstable. So as Dr. Sal says, when you grind it up, then you're exposing it to the oxygen in the air, and then they can oxidize. One of the great rules that I love is you should only eat food that can spoil.
That's
Don't
true.
eat food that has a really long shelf life. There's a reason for that.
True. Exactly.
Yeah. Dr. Sal, you mentioned something about curcumin, and the question is the spice, is it the same as cumin or is it turmeric?
It's actually turmeric. Yeah, it's the spice. It's the spice itself, you know. And I tell you, I really probably before 6 years ago, I was definitely not a spice guy, but I've kind of forced myself to use so many different spices, even if their flavor is more strong, you know, and tangy or whatever the word is, because what I put in my brain is the fact that I know that these herbs and spices and chemicals are really going to be healthier for me. So, you know, changing your mindset and looking at food differently really is helpful on that journey from the standard American diet to more plant-based foods. And when you start looking at food as a more of a benefit, and a lot of people will actually look at a plate of whole foods and feel like, oh my gosh, you know, where's the meat? Where's the dairy on there? I'm depriving myself. If you really flip the thought around in your head and say, because I'm getting those things off my plate, I'm actually rewarding myself with healthier food that will increase the quality of my life and undoubtedly increase the longevity of my life. So I think we really have to look at food very differently and see also how you feel. You know, how do you feel when you eat a healthy meal, as opposed to how do you feel when you eat a high-fat meal? You're not going out and you're not going out to run a 5K with Ted if you're eating a bad meal. That's for sure.
Right. Right. Thank you for that vote of confidence. Allison, what's next? Yeah.
So I see a question here about food swamps, and I think it's a really good thing to kind of address, and maybe I'll start and then take it away from there. But I think we hear more commonly about food deserts, places where there's really not good access to food at all, which is a really huge concern. And I also, then you kind of think on the flip side, a food swamp is actually where there's more unhealthy options such as fast food or kind of convenience stores that don't have any fresh options, or even kind of your rice and beans options, gas stations, things like that. Then there are fresh options. So it's kind of the super saturation of a geographic area with food, but not necessarily healthy food, or not necessarily what we would call food on the whole food plant-based diet. And so I think that kind of ties into a bigger question for you, Dr. Sal, of you know, what place does lifestyle medicine and this focus on food have in addressing our kind of national food insecurity issues?
Yeah, I think that is such a significantly important question, not only to simply just answer, but how do we help individuals in those communities? When I drive down Martin Luther King Boulevard in my neighborhood, going to the interstate, it is actually a food desert and a food swamp at the same time. There are no grocery stores, there's no big grocery stores, and there are several of the small bodegas and even roadside grills that people will come out and grill on and sell with the most unhealthy food you could imagine. So I think as a nation and as individual communities, it really is inherent. It's so important for us to really find a way to change those neighborhoods, because those are the individuals that show up at our doorsteps in the emergency rooms and in our clinics with all of the chronic diseases that are late stage, if you will. And I know, Ted, you were talking before about that you guys in your program really help underprivileged individuals. What can you tell the audience about that?
So we have a grant actually from the T. Colin Campbell Foundation to bring local Rochesterians into our Jumpstart because, you know, oftentimes the people who need this the most can't afford it. And so it is really a challenge. There's no question about it. We know that minorities and people of color are at most risk for having bad outcomes from COVID. And so it's a really important group to reach. And there is no perfect solution, but we are trying. And as I said, we have a grant for that. So if people are in the Rochester area and who can't afford to do our program, we do have some help for you. We are looking for donors at the national level to help us reach more people.
You know, but
we're a nonprofit. So.
Yeah, I mean, that is so important. And certainly if you can't infuse healthy food into those communities by putting a grocery store in a food desert, then obviously bringing people into a program such as the program that Dr. Barnett runs is really important. But we could all do other things individually. You know, one of the things that I've done in the past several months, there are more homeless people in my neighborhood and probably in your neighborhoods also that are out on the streets now, you know, with their cardboard signs asking for money because they're homeless and they're hungry. Initially, I would, you know, give people a few bucks and hope that would be helpful. But now I actually keep food in my car and I keep food in bags, and I'll put some other things in bags and actually give out bags of food, because if that's what people need, then we should find ways to give it to them. And it's certainly easy for us to do that. You know, when you're blessed with a lot of the things that we're all blessed with, finding ways to, you know, to pay it forward, if you will, I think is something that we all as human beings should be doing for people.
Actually, I'm going to answer, there's a question here from someone who's asked a number of great questions. And so Lucia, you asked, what is the cost of the Jumpstart program? And you also said, I'm 100% Latina and my community suffer from high rates of cancers, hypertension, heart disease, etc. Is it possible to eat WFPB and still enjoy our cuisine? So I love that question. And I'm going to answer it really quickly. Two ways. I'm going to turn over to Dr. Sal, but the Jumpstart that we run in Rochester, it's $149. And it's, when I say Rochester, it's actually available all over the world now. So we've had people from almost 40 states take the program, and 3 Canadian provinces and England. You know, basically we run it in English, so that's about the main requirement. As far as enjoying the cuisine, we have a number of people who are Latinx, and so I think that it's really about the spices, right? It's about the kind of herbs you do. I mean, think about bean burritos. They can be made completely whole food, plant-based. In fact, we had one of our participants from in the current Jumpstart. He was really concerned about he'd be able to have a burrito, and he's from Buffalo, and he's so excited to find out that he could have a burrito that he actually sent a picture in and posted it in our. We have a little classroom that you're part of when you do our Jumpstart, and he posted a picture of his bean burrito very proudly, and I'm so proud of him. I can't tell you how excited I was for that. But yeah, you know, think about what differentiates different cuisines. It's really the spices. And as Dr. Sal is saying, we got to eat more spices. So Sal, what do you think about that?
I think it's a great question. You know, one of the things that you can do, and certainly you can go along that spectrum of processed vegan foods, if you will. So you want to be careful about that. But, you know, for individuals that really want the Latin look of the food in and of itself, you know, tofu crumbles look like meat, and they certainly will take the taste of whatever else you're cooking with. So if you're cooking with lots of vegetables and spices and all, you can really create burritos and tacos and things like that. Certainly with beans that you mentioned, the tofu curls, there are really so many ways. And this, you know, I certainly don't want to get off on a plug for CHIP, but you know, CHIP is certainly a program that teaches you how to use a lot of other foods that you wouldn't necessarily use because you don't know how to use them. So really learning how to cook with other foods that can duplicate the foods that you like culturally is a really important thing to do, because you don't want to tell somebody that's Latin that you can never have a burrito again. And then the other thing that helps
Right.
for that individual is just get out there and do as much salsa dancing as you can. There's salsa and there's salsa, and it helps you to burn the calories.
Mhm. Dr. Sal is speaking from experience. He's a dancer
Yes, I
himself.
love it.
So, and yeah. And you did mention CHIP, which is fine. I think CHIP is a great program. It's the Complete Health Improvement Program. That's 18 sessions in the current iteration. And as Dr. Sal says, they teach a lot about, how you can combine foods and how you can make any kind of cuisine healthy and plant-based. Our program, the 15-day Whole Food Plant-Based Jumpstart, actually, I'll just mention, there was, I know Dr. Sal mentioned about making small changes, and actually the Jumpstart that we teach is all about making a big sudden change.
Right.
And there's two approaches, right? You can do the big sudden change, or you can do the gradual change. I like the big sudden change because in 2 weeks, people can find out whether we're telling them the truth or not. And we tell people, look, you're a grown-up. You can do anything for 2 weeks. Just do it. And they get their cholesterol checked at the beginning and at the end, and they find out, wow, really, my cholesterol really dropped 50 points in 2 weeks, and I actually enjoyed myself and I wasn't hungry. Yeah, it did. And your blood sugars are under better control and all these things. So we like the short program, and then people can find out whether we're telling the truth or not, because you never know whether it could be fake news. So yeah, that's our approach. Yeah, what else do we have, Allison?
So a few questions here, just a few little specific ones. I'll stack them right on top of each other. One is asking about the association between meat and cancer, and asking, does this also include fowl? And then before I toss it over to you, another one asking or confirming, is it okay to include fish periodically, or is pasture-raised chicken okay to include? And then one other one that I'll pair with those is, what about just eggs substitute made from plants?
Yeah, and I want Dr. Barnett to add on to this, because he's certainly had extensive interaction with Dr. Campbell. If you read Dr. Campbell's book, The China Study, where they really looked at communities, that they were actually cities that ate specifically plant-based foods versus areas that ate more animal protein. Regardless of the type of animal protein, there was a higher incidence of chronic disease and a higher incidence of cancer. So the WHO report was specifically looking at red and processed meats, but when you also look at chicken and fish and other animal protein, including dairy, and certainly Dr. Barnett's book on the cheese trap, you see that evidence really shows that we are not really made to eat animal protein. We are certainly more healthier as a population eating plant-based foods, and individuals that eat more animal protein from whatever the source have a higher risk, and in many cases a higher incidence of disease. So I think that's the short answer. Ted, I know you've had a lot of experience with and conversations with T. Colin Campbell. What do you think about that?
Actually, I was just typing an answer to somebody else. So we were talking about, Allison, hit me with a question again.
So just thinking about, is it meat, or is it the type of meat? So asking about fowl, asking about like organically raised animals, or
Sure.
yeah.
So the cancer risk is pretty much the same, certainly with fowl, chickens. Are you going to be getting less of the pesticides with the organically raised animals? Maybe. It's not a guarantee, because it depends, how these animals are fattened. And so I would say, if you can avoid, if the healthiest diet, honestly, is to avoid all animal protein, including fish and fowl. The omega-3 fatty acid issue that we've raised, yes, you can get omega-3s from fish, but most fish is very contaminated now because of mercury and PCBs. So we really don't recommend that. Plus, the fishing industry is about to run out of fish, and it's a disaster for the environment. And any way that we can learn to avoid using animals from the wild is really optimal. I think we're we'd like to leave a better planet for our kids and grandchildren and their grandchildren. And I think that the best way to do that is to really avoid all animal products, and that includes animals from the wild or from factory farms. So that's, of course, I'm a vegan, so you'd expect me to say that. So,
Well, but that
but I
really is
believe
an important point. I think you raised the point that this is not only about us as human beings. It's about the suffering and the torture and the sacrifice of literally billions of animals every year. And then the effects of agribusiness on the planet is just devastating. So, you really get the triple whammy, if you will, when you're changing to a plant-based diet, because you're improving the health of the human, the animals, and the planet. So there's no negatives there as far as I'm concerned.
yeah, I appreciate that. Yeah.
And then I wanted to follow up quickly on one more, just asking about just egg substitutes made from plants. And I think this kind of brings up a good point between the difference between vegan and whole food plant-based. And just kind of more explicitly talking about that, thinking about whole food plant-based, my understanding, and then please correct me, is that you're wanting to get fruits and vegetables as close to the form as they were grown in. And often you can find meat substitutes, you can find egg substitutes, you can find a substitute for most other products that are vegan, but not necessarily carrying the same health benefits as the whole foods. Is that kind of on track there?
Yeah, I like, Ted, I definitely agree with you that there are many people that will do a Jumpstart effectively, and it really is eye-opening. And we've seen this certainly in the CHIP program, how quickly your numbers will change, blood pressure and glucose and cholesterol numbers. In the 4-week period, things get dramatically better. For the individuals that are not, strong-willed enough to make those significant changes, then the foods, Allison, that you're mentioning really become transitional foods, taking them from the standard American diet to more whole foods. The individuals, a lot of the patients that I see will say, well, can I have a Beyond Burger? Can I have an Impossible Burger? Can I eat some of these plant-based meats that are in the grocery store? I think if you need to do that emotionally to get you from where you are to where you need to be, I think that's very effective. So you have to know the individual, and certainly in Dr. Burnett's program, he knows the people that are ready and willing and able to do a major change right away. But then we also get the people that really need a slower transition and the transitional foods to get them to where you really need to bring them.
Right. You asked about the difference between vegan and whole food plant-based. I like to draw a big circle. That's vegan, because basically it's just any food that doesn't have animal products in it. There's a smaller circle inside that big circle that it's a healthy whole food plant-based diet, and that's where I think that's really the sweet spot. And this big circle, by the way, is infinite. So a smaller circle inside that is also going to be infinite. So there's really no limit. I mean, there's a huge amount of food that you can eat. You're really not giving up. You're actually moving in. You're opening yourself up to many, many new foods. It's just really, fantastic. We've had a number of people come to us who have been vegan for many years, and they say, "Gee, how did I end up, getting a stent? How did I end up with heart disease?" And it's because it's right. A number of people have become vegan for animal rights reasons, and they continue to be junk food vegans. And so chips and soda, and that's maybe not any healthier, and clearly not a healthy diet. So we really encourage people to learn about what a whole food plant-based diet is. It's actually, the rules are pretty simple once you understand it. Just avoid fractionated food. If I send you into the woods to find food, you're not going to come back with oil. You're just not. Or you're not going to come back with white sugar or white flour. You're going to come back with down where Dr. Sal is, you're going to come back with a coconut or some dates, right? Or maybe some oranges. Up here, you might come back with some, wild garlic, or who knows, lots of things, nuts. So, but just think about those terms. Try to keep it really simple, which is, whole food plant-based diet does not include oil. A lot of people have to grapple with that because they think olive oil and all these other oils are going to be so healthy. So we don't advocate that. And we find so many people who have said, "Gee, I've been doing this for years and nothing worked until I gave up the oil. So, Dr. Sal, any comments on that?
And well, we really didn't touch on, just for a minute, when we use the word diets, there still is that belief and that myth that keto diets are healthy. And I recently had a patient that was referred from Dr. Khan, Joel Khan. The individual found him online, and he knew that I was down here and the patient was down here. And this guy was on a keto diet for about 8 years, and a miserable diet, even more miserable diet before that, and ended up having coronary calcium score of like 2,300. I mean, just really terrible numbers. We really have to help people see the reality of what happens when they're on a diet. What we talk about is a nutrition program. It's not a short-term diet. This is something that you're going to do forever because it's the right way to live. So get rid of the myths about what a diet is all about. You shouldn't be going on a diet because you want to show up at your 30-year high school reunion. You should be on a healthy nutrition program so that when the 30-year reunion comes around, you're already in good shape to go.
Right. And yeah, you'll be one of the people who shows up because you look good.
That's it. I'm going. I'm beyond 30
exactly.
years though.
Yeah. So it looks like we have time for one more question. It's 8:28. Let's. What do we have, Allison?
So here's an interesting one, kind of more on the medical side. Often, so this person asks about, they have a history of GERD, and their doctors normally say avoid spicy foods, citrus, soy foods. And, we've been here talking about, we like spices, citrus is part of our fruits and such. So what's kind of the overlap, or how do you best approach that?
The commercial with that guy that's holding up a drumstick for the purple pill, the commercial, he's basically saying, eat whatever you want, then just take this purple pill and your heartburn will go away. The problem is what he's got in his hand, and GERD in and of itself usually is not caused by citrus fruits and by soy products. It's usually caused by high fat, high sugar, the standard American diet that people eat and overeat. So I can't tell you the last time I had somebody that was on a whole food plant-based diet that said that they get a lot of heartburn. It's usually just the opposite. I'm not sure that we're going to find a lot of randomized control studies, but the anecdotal stories that I can tell you really support that statement.
Yeah, we see the same thing. We have people come to us because they want to get their cholesterol under control or their blood sugar under control, and after a week or two, they come back and they say, "Gee, my heartburn's gone. I didn't expect that, and my joints. I didn't even know my joints were hurting, but I guess they were because now I can move."
Right.
And so you get all these things that people weren't expecting, and heartburn and GERD are definitely one of them.
Yep.
Well, look, yeah, it's 8:30. And I would like to thank everybody for sticking around.
Yes, indeed.
Dr. Sal, this was fantastic. And Allison, I really appreciate your help. Allison is a third-year medical student at our local University of Rochester Medical School, and very proud of her for being involved with our current Jumpstart. And so, yeah, love to. There's going to be we have some more Lifestyle as Medicine lectures coming up. Please take a look at our website. I think the next one might actually be. Well, take a look at, here it is. Let's see, we got, Brenda Davis will be talking about low carb diets, and she'll be debunking keto and paleo. That's April 18th. And then Virginia Messina will be talking in May. So about bone health. So I don't know if they're going to measure up to Dr. Sal's presentation, but
yes, they will. They're great speakers.
So yeah, anyway, thank you all, and good night.
God bless everybody. Stay well.
Right.